Although lying in bed for days on end may sound like a sweet relief for some, there are a number of negative side effects to staying in bed for too long, including the development of bed sores and painful backaches. You are also more susceptible to stress and depression, as well as other psychological and cardiovascular issues. Adequate rest is important for human beings and all other living creatures, but technological progress and the modern age have made it even easier to survive from the comfort of one's bedroom. With so much accessible at the touch of a button, the temptation to lounge horizontally all day is high. You might think that getting paid to lay in bed all day sounds like a dream. Well, for Drew Iwanicki, that dream came true when he volunteered for a NASA study investigating the side effects of extended periods in bed. With long-distance space travel rapidly approaching reality, NASA needs to understand what effects lying prostrate for days, weeks, or months at a time might have. Back in 2014, a study was carried out to determine the nature and magnitude of the deterioration of human bones and muscles in space. The study required Drew Iwanicki to lay down on a bed for 70 days straight without getting up for any reason, except for 30-minute periods where he could prop himself up on his elbows to eat. While the study earned him a tidy $18,000, it was obviously a huge challenge. What the study found was that a person lying down with their legs raised would have more blood flow to their head, which is a condition similar to space travel. This brings us back to the main question: on a much shorter time scale, could extended periods in bed also be unhealthy for the average person? The short answer? Yes. Too much bed rest in any position can be detrimental to one's health. In the course of our normal lives, we rarely remain in one position for more than 6 to 7 hours, even while sleeping, because we turn, twitch, and reposition during the night. If you don't move at all, pressure ulcers, known as bed sores, may develop. If left untreated, bed sores can result in infections, negatively affect the bones, and even prove fatal. Even if you aren't bedridden, too much time in bed can still be dangerous. Some patients with lower back pain may actually worsen their chronic pain if they are prescribed bed rest. Bed rest may reduce strain on an injury or weak area, but it also causes muscle loss. This can lessen support for the backbone while also wreaking havoc on the gastrointestinal system. You also increase your risk of blood clots, which can lead to a potentially fatal pulmonary embolism. Aside from the physical effects, mental health also suffers when one is confined to bed. Depression and neurosis are more common in those on bed rest. Studies have also found that pregnant women prescribed bed rest experienced higher levels of depression, anxiety, headaches, muscle atrophy, and weight loss. In some cases, such as a traumatic brain injury or other immobilizing accident, bed rest is the best possible solution, but unregulated and indefinite bed rest can be a dangerous thing. Even the most relaxing and nourishing behaviors must be practiced in moderation. So, no matter how tired you may feel sometimes, it's important to get yourself out of bed and go explore the world.